Good afternoon. My name is Tobias. I work as a physiotherapist in the fields of intensive care medicine and neurosurgery. One of the biggest problems after big and long surgeries is that patients had too long periods without any movement. This causes loss of muscles, problems with the pulmonary function, and several other complications. According to the latest guidelines, it's recommended to start the mobilization. That means treatment movement for the patient within the first 3 days after the admission to the intensive care. However, the reality shows that the required methods are too extensive for the limited hospital staff. There were mainly two clinical problems that I want to solve. The first problem is that before patient can be moved into chair, it's required to mobilize them at the edge of the bed. It's necessary to check for a stable blood circulatory system, and therefore two therapists are needed. If complications occur, it's easy to shift the patient back within seconds, compared to moving him back from a chair into bed. The second problem is that there is no option to mobilize patients that are connected to a heart lung machine. The area around the pelvic joints can only be slightly bent because of the connected tubes. So neither a physiological sitting position nor a transfer into a chair is possible for these patients. These circumstances lead to the fact that patients are not sufficiently mobilized, and this became the foundation of my idea for the seat assistant. Key features of our solution are a backrest as frame construction, covered with a washable fabric, an adjustable sitting angle, armrests, and several safety measures to keep the patient in a sitting position. A modular connecting system for the different bed frames will round up the system. This is how it works. You can see how easy only one person can mobilize a patient. First, attach the seat assistant to the edge of the bed, then turn the patient over the side, bring the feet down, sit them up, and lastly, adjust the backrest to the patient's back, and you're done. The seat assistants allow for an earlier and safer mobilization. Since the patient are still on the bed while being mobilized, moving them back in case of emergency is possible within seconds. It also allows for an optimal support of the patient's training level with the existing hospital staff. We will start with the intensive care market, but think beyond ICUs. The seat assistant can help any impaired people, and we can enter also an even bigger market. With the seat assistant, money can be saved by shorter stays at the intensive care units, cutting the amount of work in half and make it easier for the existing hospital staff, and a more efficient workflow because more patients can be mobilized while a shorter time. Competitors offer a variety of solutions where the patients have to leave the bed. This is not only very challenging, but also requires for stable circulatory systems. These solutions are chairs-like care systems in which the patient needs to be transferred via ceiling lifting system or other complex tools. Of course, it takes more time, and our competitors are even more expensive. The obvious complexity of this system prevents the mobilization according to the current guidelines. With our seat assistants, we never want to have this problem. We have filed a patent and have built our first prototype. Currently, we're working with one of our mentors to get a CE mark, and the University Clinic Tübingen has agreed to help us with conduction of clinical trials to obtain a medical product approval. At the moment, there are 25,000 intensive care beds in Germany. We asked leading physicians about their need and discovered that one seat assistant would be needed for 7 patients. This leads to a first market size of 3,700 devices, only for the intensive care sector. We've also found out that we are able to realize a price about 3,000 euro for each, which leads to a first market volume of more than 8 million euro only for the intensive care sector. And of course, we won't stop here. We will extend to other markets. With our partner, the orthopedic technology company Brillinger in Tübingen, we want to develop a second and high-fidelity prototype so that we can move into clinical trials to prove our concept. And an additional goal for future will be to apply for a Hilfsmittelnummer. This is our team. Fernanda has over 3 years of sales experience, Thomas with economical background, Leander studies medical engineering, and I have been working as physiotherapist for 4 years at the intensive care. I know what really works with the patient every day, and I bring some technical skills with me. Our seat assistant will help patients to recover faster, allows mobilization according to the current guideline, and will save hospitals horrendous sums of money. Mobilization matters. Let's make it easy with the seat assistant. Thank you.